Audio lectures. So we're still on the axial skeleton. So in the first part we looked at the skull, and in this part we're going to look at the spine and the ribs, and then we'll move on to the appendicular skeleton and the arms and the legs. So we're really in this section we're talking about the spine or the vertebral column. So it's made up of 26 irregular bones. We're going to see a picture here in a second, connected to produce a flexible and curved structure. It's going to extend from the skull to the pelvis. Okay, it's going to surround and protect the spinal cord. So that's its main function, is to surround and protect the spinal cord. And it's going to also provide attachments for your muscles of the back and the neck. And again, this is going to allow us to create a little bit of motion in there too. So let's look at a picture here. And this is our picture of our spine, okay? And this is if you reach back behind you and you just kind of put your fingers kind of in the middle part of your back, you'll be able to feel those spinous processes of the spine kind of sticking out. So that would be like this part here. But we can see that we have all these bones just kind of stacked on top of each other, and we get different little sections. And this is kind of what I deal with every day as a chiropractor, is you get your cervical spine, okay? So that's your top 7 vertebrae. Then we get our thoracic spine. So you have 12 of those. That's going to make that middle part of your back. And then we get our 5 lumbar vertebrae. So that's what most people consider their low back. And at the bottom, you're going to get your sacrum, which you can kind of feel a little bit if you reach down, but most people are just familiar with your tailbone or with your coccyx, which is the very end, okay? And the other thing I want you to pay attention to is we have these little curves in there, right? So your neck is supposed to curve one way, the middle part of your back is going to curve the other way, and then the lower part of your back is going to curve this way also. These curves are really, really, really important because what they allow you to do is kind of stack your weight on your spine and give your muscles a little bit of a rest. And what you do find a lot, especially now as we sit kind of more and more, is that we start to kind of lose these curves. And what happens as your back and your spine kind of straighten out is that you're going to have to kind of use your muscles even more. And then they just fatigue, and they just get tighter and tighter and tighter. So one of the things you'll find on an x-ray, or if you take an MRI of somebody's spine, is you want to look for these curves, and are they able to sort of maintain these curves? Because again, once these curves kind of start to disappear, I'm going to have to use my muscles kind of more and more, okay? So if you're talking about someone like neck pain, you're talking about the cervical spine. If you're talking about their low back pain, you're talking about these lumbar vertebrae. Okay, and then here is a picture. One of the other cool things with the vertebrae is because I have all these bones stacked on top of each other, your body is only allowing a little bit of movement at each segment, and it does that in an effort to protect the spinal cord as best as it possibly. So we don't want a lot of motion on one segment because then it would make the spinal cord more vulnerable. So what we do is we stack these bones on top of each other. We allow a little bit of motion at each segment. You can see here I have 2 vertebrae stacked on top of each other. I have my disc in the center here, and that gives me a little bit of motion between these 2 bones, but that keeps the spinal cord really, really safe. But overall, it gives me a lot of motion in my spine where I can bend and flex and turn to the side. Okay, so when you look at this picture, you can see that those spinal curves are going to change, and that little bit of motion between each of these vertebrae is going to actually add up to a ton of motion in our spine just in general. So you just want to keep that in mind, is that we're allowing a little bit of motion at each segment, which overall gives us a ton of motion, but it keeps that spinal cord as safe as we possibly can. Because again, spinal cord injuries are, really, really dangerous. Okay, so we have these major supporting ligaments of your vertebrae, and you're going to have kind of ligaments on each side of the vertebrae, but they're going to form these continuous bands down the back and front surfaces. This is more for just our labeling purposes for our practicals. Okay, we're going to have an anterior longitudinal ligament. We're going to have a posterior longitudinal ligament. We're going to have a ligamentum flavum, and then we're going to have a supraspinous ligament. So these two, the anterior longitudinal ligament and the posterior one, are going to more be dealing with the body of the vertebrae, and we'll look at all the parts of a vertebrae in a second. The ligamentum flavum is going to be a little bit different. It's going to kind of be behind, more towards as we're getting towards the spinous processes, and it's going to kind of line the canal for the spinal cord. And then my supraspinous ligament is actually going to link all the spinous processes together. And again, it'll make much more sense when we switch over to the picture. So here's our picture. We have our vertebrae stacked on top of each other. We can see the discs, and this is going to be the body of the vertebrae, but we're going to have a ligament in the front. That's the anterior longitudinal ligament. We're going to have a ligament in the back of the body, which is the posterior longitudinal ligament. And then we have our ligamentum flavum, and you can see that I've created this little canal for my spinal cord to pass through, but I have ligaments on the front part of the canal and ligaments on the back part. The part of the ligament that goes on the back part of the canal is going to be this ligamentum flavum. And this is a really, really important one because as our body kind of absorbs a lot of stress, and if your body is sensing that you have a lot of stress on your spine and we're creating some damage and it wants to add some stability, one of the ways it's going to do this is it's going to start to thicken up these ligaments. But what happens is it does make the spine a little bit stronger, excuse me, but it also starts to take up room for that spinal cord to travel through, and that can become a big problem too. Okay, and then the one at the very back here, you can see these are my spinous processes, or those big bony spots on your back, but I'm going to have another ligament that kind of links them together. So I've tried to add, a significant amount of stability. So here is a picture of or an MRI of your spine, okay, and I can see here are the bodies. I can see my discs in between there. I can start to see my ligaments in the front, the ligaments in the back, and then this is my spinal canal, okay? This one right here is my ligamentum flavum, and you can see that as this person's gotten older and they've started to sort of put a little bit more stress on your back, this ligament's going to start to thicken, and again, it's going to start to encroach or sort of impinge the spinal cord as it's trying to kind of travel through this little canal. Okay, so one of the things that I'll see on MRIs, or one of the things that'll show up on people's X-rays when they bring them into me to sort of get reviewed, is that you're going to hear the radiologist say, hey, there's a thickening of the spinal ligaments, and most of the time it's going to be that ligamentum flavum. Okay, so remember, we have the one on the front of the body, back of the body. Ligamentum flavum is going to be that posterior part of the canal. But a really, really important one, if your parents get MRIs or you guys get MRIs in the future, it's one of those things that they'll mention that a lot of people are just not familiar with. Okay, so in between each vertebrae, we've seen this too. We're going to have these discs, and everyone's heard about, a ruptured disc or a bulging disc. This is what they're talking about. So these are my intervertebral discs. Intervertebral just means they're in between the vertebrae. It's a cushion-like pad composed of two parts. Okay, they're going to act as a shock absorber, but again, as we already talked about, they're going to allow a little bit of movement in between each one of these segments. So this is my disc. So the inner part is going to be called the nucleus pulposus. So it's the gel inner part. It's going to give your disc this elasticity, this compressibility, and then we're going to have a stronger part on the outside. That's going to be the annulus fibrosus. So it's going to surround the nucleus pulposus. It's going to be composed of fibrocartilage. It's going to have collagen fibers in there to make it really strong. And its main job is just to limit the expansion of the nucleus pulposus and kind of keep it in place as we're moving around and sort of compressing our spine. So here's a picture of your disc. If we looked at a vertebrae from the top, you can see the disc is going to sit right on the body. But I can see this inner gel part. So that's my nucleus pulposus. And then I get this stronger part on the outside, which is the annulus. And again, this is a really important picture because you can see that opening for the spinal cord, and you can see whereas if I start to have issues with this disc, what's going to happen is the way we load it, it's going to start pushing back towards the spinal cord, and it can impinge the spinal cord itself. Or if someone gets pain on the left side and not the right side, or vice versa, we know that that disc is kind of pushing back more on the root of that spine and sort of only hitting that one side. So a lot of times based on their symptoms, if it's bilateral, pain in both legs, numbness in both legs, it's actually hitting the spinal cord. If it's just on the right side, it's just hitting one of those little nerve roots. Okay, but you can see that there's not a ton of room in there, so this is a really, really important thing. Okay, so here's our picture here again, and we can see where, a lot of the things we're going to do are inflection. So we can see with this person, where as they bend forward, we're going to compress that front part of the disc, and it's going to bulge backwards into where the spinal cord is going to be. Okay, and that's for most of us where we sit all the time, we're driving, we're doing all these things in flexion, and we kind of load that front part of our vertebrae, and we end up pushing that disc kind of back into those openings for the spinal cord and for those nerve roots. Here's an MRI of a ruptured disc. Okay. So again, anytime you look at anything, you want to kind of orientate yourself. So you want to find the bodies, and you can see that the little nucleus pulposus, this is how it's going to show up on a normal disc on an MRI. And you can see at the bottom here where that inner part has actually broken through the annulus and sort of ended up in where the spinal cord is supposed to be. So this would be a ruptured or a herniated disc. And a herniation or a rupture means that the annulus is broken and that nucleus pulposus has pushed through. Okay, if you just have a bulging disc, it means that that annulus or that fibrous part is still intact. It's just pushing itself back into, and it can eventually become a ruptured disc. So, but you can see how once I start putting pressure on that spinal cord, I can get all kinds of different symptoms to anywhere that those nerves are going to go in the body. All right, so now we look at the general structure of a vertebrae, and again, this is more for labeling purposes, but all vertebrae are going to have a common structural pattern. So the neck ones, the thoracic ones, the low back ones, they're all going to have similar structures. They're just going to change a little bit, but you're going to have a disc-shaped body in the front or anteriorly, and then we're going to have this vertebral arch posteriorly. And again, we're trying to create this opening for the spinal cord. So together, they're going to form an opening called the vertebral foramen. And then when we stack them on top of each other, okay, they're creating this passageway for the spinal cord to pass through, and that's going to be called my vertebral canal. Okay, so with each vertebrae, the opening is the vertebral foramen. When they're stacked on top of each other and we create this canal, it's going to be called this vertebral canal for your spinal cord. So here is our little picture, and we want to find the body, and then we can see posteriorly we have the arch, and again we're creating this opening for the spinal cord, which is called that vertebral foramen. So we also have a couple other things in there that you just saw in the picture. We're going to have a pedicle, and these are going to be the short bony pillars projecting posteriorly off the vertebral body. And again, I'm trying to create the arch. So this is the first part of the arch. And then I'm going to have a lamina, and that's going to be the very back part, which is going to kind of complete that arch posteriorly. So we'll come back to the picture here in a second. We're also going to have an intervertebral foramina. Don't get this one confused with the vertebral foramina. This one you're going to see more from the side. And again, we'll see a picture here. But these are the openings for more the nerve roots instead of the spinal cord itself. We also have a spinous process. This is the part where if you reach back and you kind of feel that middle part of your back, you're going to feel those bony little things poking out. That's going to be your spinous process. We're going to also have these transverse processes that are going to extend laterally from side to side, and this is where our muscles are going to attach and allow us to kind of turn our back and bend it in different ways. And we're also going to have these superior and inferior articular processes. And these are when the bones are stacked on top of each other. These are the points that they're going to kind of interact. So articular just means joint, and it means where two bones are coming together, and we're creating these joints between these two vertebrae. So they're going to protrude superiorly and inferiorly. And again, I'm creating these joint surfaces, and then those are going to be called facets. Okay? But you want to go back to the picture, and we just want to make sure that we can label all these different things. Okay, so here's the body. Okay, here is my pedicle. And then I'm continuing the arch, so this is the lamina. This is my spinous process back here, and then these are my transverse processes that are going to stick out to the side. And on this one, I can see this the facet on the top part. So again, when we stack these on top of each other, these are the points that the vertebrae are going to interact with each other. And then I'm creating this vertebral canal for the spinal cord to pass through. Okay? If we look at the side, this is the part that gets a little tricky. This is going to be your intervertebral foramina. And again, the vertebral canal is where the spinal cord goes. This is where the roots are going to come out and sort of go to every little part of the body. So the IVF is the one you're going to see only when you're looking at it from the side. But I can see these little facet joints where the vertebrae are interacting with each other, and I can also see the disc in this one too. So again, you want to make sure you can label all these different little things, from the front, the side, the back, the top, all the different little angles. This is one that just gives you a little summary of how they kind of change. One of the biggest things you're going to see that kind of changes with these vertebrae is that as you get further down in the spine, so you have to think about your neck is just holding the weight of your head. Your thoracic spine is holding your head and your shoulders, but my lumbar spine is kind of, it's taking all the weight of the whole body. So one of the biggest things you find between the vertebrae and how they're different is that the lumbar ones are going to be way bigger, and it's just because, again, they're absorbing more weight, okay, and they're sort of absorbing more stress, so they're going to need to be a little bit larger. The cervical ones are a little different. Again, they're mostly concerned with rotation of the head, so they're going to be a little smaller, a little bit thinner. And then we can see some pictures here too. Okay? And this is where we have, if we were in the lab, we would have the bone boxes, and you could actually take the vertebrae out and kind of get a good look at them. One of the other questions that comes up a lot on more like multiple choice is that you can see in the cervical ones, in my transverse process, I have this other little transverse foramina that does not appear in the other one. So this comes up on your multiple choice all the time. Which vertebrae has a transverse foramina, and it's going to be the cervical ones, and there's an artery that's going to run through this one that's going up to your brain too. So that's just one of those things that pops up a lot on your test. But all the other structures, they're a little different, but they're going to be very, very similar. Here's a picture from the side, and you can see with the lumbar ones, they just get bigger and thicker and stronger because, again, they're bearing more weight, okay? And then we get to the bottom part of the spine, which is going to be your sacrum and your coccyx, okay? And this is kind of like that triangle bone at the very bottom of your spine. It's basically made up of these 5 fused vertebrae. It's going to articulate superiorly with the L5, so with that bottom lumbar vertebrae. It's going to articulate inferiorly with the coccyx or your tailbone. And we're also, this is the most important part, we're forming 2 joints laterally with the pelvis. So I always tell people in my office, your sacrum and your coccyx, that's kind of where my spine and my pelvis come together. And I create these 2 sacroiliac joints, which if you put your thumbs, people talk about the dimple in their back. But a lot of times people come in and they go, oh man, I have this pain. They'll just put their thumb right on that little dimple in their back. That is going to be your sacroiliac joints, okay? So it's where your sacrum and your ilium or your pelvis are going to kind of come together. Very, very common spot for a lot of back pain, okay? But it's better to have kind of sacroiliac pain rather than disc pain, because this is just two bones coming together. There's no spinal cord, there's no disc that you have to worry about too. Okay, and then my coccyx is my tailbone. 3 or 4 fused vertebrae, small triangular bone. And again, it's going to be the tailbone is more how most people are going to know this one. But here is a picture of my sacrum. So here is my little triangle bone. This is where my pelvis is going to come together and form those sacroiliac joints. This is where that lower lumbar vertebrae is going to sit. And then I have my tailbone or my coccyx kind of right at the bottom. All right, and then here is a picture of those sacroiliac joints. You can see my spine here. This is my sacrum. And you can see how this is how I'm connecting my spine to my lower extremity and sort of to my pelvis girdle. Okay. So now we get to the last part of, the axial skeleton, which is the thoracic cage and the ribs. So this is the bony structure of the chest. It's going to include the thoracic vertebrae posteriorly, my ribs laterally, my sternum anteriorly, and then I have my costal cartilage anteriorly also. So we want to look at a picture here and look at our ribs, but I can see I have my spine in the back. I have my ribs running from my spine all the way up to the front part of my chest, or that sternum in the front, okay? And then you can see that I have all this little cartilage, and you have to have the cartilage in there because it has to be a little more flexible because, again, every time I breathe, my ribs are going to have to expand. They're going to have to contract. They're going to have to move a little bit. And then, again, you also want a little flexibility so that every time I fall. I don't end up breaking my ribs if they were a little bit too rigid. Maybe you can see where all your ribs are coming up and they're kind of attaching in the front part to that sternum. In the back, they're going to be hooked up to those vertebrae. So the sternum is also known as your breastbone. It's going to lie anterior midline of the thoracic. It's going to be the fusion of 3 bones. So my manubrium, and again, this is more for labeling processes. You're going to have the body, and then you're going to have the xiphoid process. You're going to create a bunch of little landmarks on there, so jugular notch, clavicular notches. You're going to have this articulation with your clavicle, so those are going to be my collarbones. They're going to come and attach to my sternum too. And then on the body, this is going to be my articulation with all my ribs, or where my ribs come up and meet up with my sternum. So here is my sternum again. I want to find the manubrium, I want to find the body, I want to find the xiphoid process, and then I can see where all these ribs here are coming up and attaching on my sternum too, and then I create these little jugular notches, I create these little sort of articulations with the ribs too. Okay, so now we get to the ribs more specifically, and we want to know that there's 12 pairs. They're going to form the flaring sides of the thoracic cage. Posteriorly, we've already said they're attached to the thoracic vertebrae. Your superior 7 ribs, again, this is good multiple choice questions, they're going to be called my true ribs. And they're called true ribs because they're going to attach directly to the sternum, okay? The remaining 5 ribs are going to be called false ribs, and this is because they're going to be attached indirectly. So these ones are either going to attach to another rib, or they're not going to attach to the front part at all, only to the back. So ribs 8 to 10 are attached to costal cartilage immediately above them. So these are the false ones that are attached to other ribs. And then my last 2 ribs, 11 and 12, are called floating ribs, and that's because they don't attach to anything in the front. They're only going to attach in the back. So you can see I have some that attach to the sternum directly, so those are my true ribs. And then I have some that come up and attach to the cartilage, right, to these bottom true ribs. And then I have the last 2 that are only attached in the back and they don't attach to anything in the front. Okay, so again, good just multiple choice questions, good for labeling purposes too. Okay, and then here's another picture of your rib coming up and inserting on its little spot on the vertebrae. And again, it just sits in this little groove, okay? And again, your ribs have to move a lot. Every time you breathe, your ribs have to move. So just remember that they're not real stationary. And then the front, they're coming around and attaching to the sternum. So with your ribs, you get, the sternal end, and then you get the vertebral side. So here's another picture of that rib coming up and articulating with that vertebrae, okay, and with that transverse process. And then here's just another picture of just the rib, and then how we have the one end and the other end, okay? This is something I deal with all the time too. I had a bunch of patients the other day that kind of, you go through cycles where people come in for the same things. This is a really, really common area to get a lot of sort of pain, okay? So you get pain kind of right to the side of the spine in that middle part of your back. You get a lot of muscle spasm. This is where the person comes in, they go, oh man, I just can't find a comfortable position. Every time I breathe, I reach, I twist, I get a lot of pain. Okay, and it really is like when you ask them, hey, do you get any sort of pain when you take a deep breath? That lets you know that it is this rib head, okay? Because as they try to take that deep breath and that rib tries to move, it kind of slips out of place on that vertebrae, and because it can't move properly, all the muscles on this whole side just go into a big spasm. And then anytime I reach or twist or breathe, I kind of get this real, real sharp pain Again, this is one of the, it's not a super serious injury, but it is one that can be just the most uncomfortable, okay? And what you have to do is just kind of ice it, and you have to kind of just kind of leave it alone. It's one of the only spots where, the more you try to make it feel better, the worse it's going to feel. So this is where you tell people you don't want to stretch it because you just end up irritating it because, again, it's moving all the time, but you just want to ice it. You want to try to find a comfortable position. And then we do some different little therapies in the office just to speed up the process and kind of get that inflammation, that spasm down as quick as possible. But I used to get these a lot when I was in undergrad before I went to chiropractic school, and I kind of didn't know what they were. And then once I got to chiropractic school and somebody kind of explained them to me, it made much more sense. Okay, but again, with all of us sitting on our computers and doing all our things where we're kind of stuck at home, and we're always reaching kind of forward, it makes it where it's really easy for that rib just to shift out of place on that vertebrae, and then it gets stuck, and then all those muscles on that side go into just a big spasm. Okay, so that's the end of our axial skeleton lecture. And then again, next time we're going to move on to the appendicular skeleton, and we'll start looking at the arms and the legs.